Hi, my name is Dr. Jay Sandys, and the question that I'm going to answer as part of this week's Small Talk, brought to you by MyWellbeing, is how do I know if I have a substance abuse issue? So before I jump into that question, let me tell you a little bit about myself. I'm a clinical social worker. I've been practicing about 25 years. I'm a psychotherapist. I'm also a workplace consultant and executive coach. I've done a lot of consulting around Department of Transportation regulations, helping companies to deal with substance abuse issues with employees, especially those in safety-sensitive positions, helping to determine what kind of treatment they might need, when they're ready to go back to work, that kind of thing. Now, in terms of substance abuse issues with my psychotherapy clients, I do get this question a lot. People unsure whether they have a substance use issue or not. A lot of my clients are emerging adults, so people aged about 18 to 26 years old. And a lot of them drank a lot, smoked pot, or took other drugs when they were in college, where it was really part of the culture. It was very acceptable. It wasn't necessarily a problem. But now that they're in the working world, things have changed. And now maybe it's impacting their work, maybe it's impacting their relationships, but they're starting to see some issues. So there are some objective measures. I use a tool called the SASE. It's a subtle screening tool for substance abuse. There are some other ones like the MAST or the DAST or a few others that are objective measures about whether someone has a substance use issue or what's the likelihood that they do. Have you ever been arrested because of a substance issue? Like, do you have a DWI? Have you ever lost a job? Anyone ever told you drink too much or you used too much drugs? Do you have withdrawal symptoms? Do you have cravings? All that kind of stuff. And so that's pretty standard. You could look that up anywhere online. The question that I really help my clients to answer is, what's the function of the substance you're using? Now, in college, maybe there was no obvious function for it. Maybe you're just going with the flow or what have you, just part of everyday life there. But now, what function is it serving? And sometimes people will tell me, when they really look honestly, that it's because of social anxiety or some other form of anxiety, or because of depression, or because they just really want to avoid dealing with a psychological issue, a past trauma, or just really any kind of emotion. Also, people feel bored. And so drinking or substance abuse can really be part of that. Or it's really similar to college. It's really their group of friends drinks a lot or uses a lot. And so that's sort of their connection to people. But really looking at why are you using the substance, what function does it serve, allows people to really say, hey, is this the right thing for me? If I'm using alcohol or drugs because I'm anxious socially, how's that going to change? Where am I going with this? And to me, that's really the road to addiction, is when you use a substance to mask or make up for some other issue. And what I really want my clients to do is have an honest discussion. Why are you using this substance? And what function is it serving? And when they stop, sometimes we're seeing all sorts of things come out. For example, I have some clients that, they'll say, I stopped drinking, and then all of a sudden I was more clear-headed. I had more energy. I was able to socialize more. But sometimes people stop using and all sorts of negative feelings come up. And that's the stuff that we want to talk about in therapy. So what I really want is I want to help my clients to open the door to exploring what are some of those things underlying that substance abuse. Substance abuse, in my mind, is always a symptom. It sometimes becomes the primary problem, but when you take it away, there's still something else there. And that's what the work of therapy is meant to do, to address those issues and to help people to move along and improve their symptoms and improve their social life and improve their life overall. There are tons of different types of treatment, from medication to outpatient to inpatient to 12-step. And I really help to guide people in the right direction for them. Maybe just cutting down is enough. Maybe they need more. Anyway, hope this has been helpful. Happy to consult further anytime. Thank you.